Hello Westford, I'm Ben Domaingue, Managing Editor here with WestfordCAT, and I'm joined today for our Community Wellness Series with Nicole Laviolette, the town's Community Wellness Coordinator, and Brittany Nash, the town's Regional Community Health and Wellness Coordinator. Welcome, guys.
Thank you for having us.
So today we're going to be talking a bit about Mental Health Awareness Month. On April 9th of 2024, the Select Board unanimously voted to declare that May is Mental Health Awareness Month. And I know Nicole and Brittany, you guys have some events, you have some updates you want to talk about. So I'll let you take it away. Start with Nicole.
Great, thanks, Ben. So Mental Health Awareness Month has been around since 1949. Mental Health Awareness Month is here to increase awareness of the importance of mental health and wellness in everyone's life. So when we're talking and meeting and having our events and just meeting with residents, we like to share that everybody has mental health, just like everybody has physical health. So what can we do to support our mental health? And if we have challenges with our mental health, how do we go about accessing those resources and supports? So as you shared, the town select board did approve the proclamation, which you can find on the Community Behavioral and Mental Health Committee's website through the town website. And in case you did not know, the town does have a Community Behavioral and Mental Health Committee. We started last March, and we meet monthly. We meet the first Monday of every month at 1 p.m. It's a hybrid meeting. You can meet virtually, or you can meet with us in the town hall. So we do have a meeting on Monday, and it is open meeting, so anybody can attend, and you can find all the information on the town's website. So through that, the Community Behavioral and Mental Health Committee really kind of looked at what could we do this month to kind of support residents and have an understanding around mental health. So we had several activities that we did that Brittany's going to share a little bit about.
Yeah, so one of the things we did was adult mental health first aid. Nicole and I are certified to be training adult mental health first aid. We're both certified, and it just brings awareness on the mental health challenges that could exist, different signs and symptoms, as well as how to be a supportive person, how to be a warm handoff to individuals. And so we were lucky enough to do that at the library on May 6th. We also did a personal wellness series presentation that was on May 14th, and that was really about self-care, how to encourage that, how to make sure that your environment and your social, mental, physical health is all aligned. And then on May 22nd, we have a guided meditation that I'll be running. I'm a certified yoga teacher. I will be doing a meditation there at the library. No registration is required for that, so that'll be really exciting. That is something that I've also done consistently in Acton because I am a shared service, so I have Westford, Acton, Lowell, and Dracut. So this Friday, I will actually be running a guided meditation at the Acton Library as well, and I do that twice a month, so you could always check me out on there as well. And then on May 30th, I am doing a youth mental health first aid training as well in Acton. I just figured we could share more than what's in Westford, considering I service for communities. And let's see, is there anything I forgot? The poster contest. Do you want to share about that?
Yeah, so the poster contest, we created a subcommittee from our Community Behavioral and Mental Health Committee to kind of focus on the different activities, and one of the pieces that was suggested was to do a poster contest. So the water department has done this in the past, pre-COVID, and we focused the contest for 6th, 7th, and 8th grade Westford residents, and the poster really is looking at how do you deal or how do you relieve stress, and it's on a paper this size, and you can use any medium that you'd like. May 20th, Monday, is the deadline for the poster contest, and there's drop boxes at the J.V. Fletcher Library, Blanchard, and Stony Brook Middle School. And so again, that's for 6th, 7th, and 8th grade students. And then we have created an additional subcommittee that's going to really evaluate the posters. We have a first, second, and third prize First prize is AirPods. Second prize is a gift card, and third prize is a gift card. And so part of that, though, is we do need parental permission to be able to have the child's information, to post the child's information, and to contact the child. So with the help of Mike Wells from the town IT department, we're also going to post all the submissions on our town website. So they'll all be there for everybody to be able to view. So that's kind of a new thing that we haven't done in the past.
And that came out of our Community and Behavioral Mental Health Committee. That's our subcommittee. The individuals who are a part of that will be reviewing the posters, and we're really excited about it. So please submit your posters.
We also had, for about a week and a half, almost 2 weeks, the mental health awareness flags around the common, if anybody drove past and saw. So we had several different types of flags, but they were there just as a visual. There's people on the common all the time, you know, and people drive by all the time. And the health department and community wellness department capstone students were kind enough to put all those out for us.
Yeah, I can certainly say I drive by every day, and I think I saw them up there until about the 10th or so. I think it was about until then. But that's great. So I guess you had mentioned the poster contest, and what I'm curious about, you know, with mental health being so important, you mentioned stress. Now I know there are several resources available for residents, activities, numbers, hotlines, whatnot, that could help folks that might be dealing with a stressful situation. Or even worse. Can you talk a bit about that?
Sure. So maybe I'll share some of the parenting supports, and if you want to talk about some of the state and national hotlines. So the town actually has a supportive Parent Solutions. We recently changed our name. It was the Parent Support Group, which is every month, the second Thursday of the month, and the mezzanine hall of St. Catherine's. And it is a wonderful place, safe space for parents to come and talk about resources, challenges, and get support, not only from Brittany and I, but another resident who was on our Community Behavioral Health Committee, Claire. And it's a space really to kind of support one another, but also learn how to support your child. So we use something called a DBT skill. So to really support the parent when you're in those challenging situations, how do you help yourself? We talk about relationships. You know, if you're in a co-parenting relationship or have a partner and you're having these challenges with your child, how do you support one another, support yourself and your child? So that has been going on almost 2 years now. That we've been offering this. We've been in multiple locations, but we're in a really great space right now as far as a comfy environment. So
I want to add to that as well that it is hosted at the church, but is not associated with the church. We just wanted to put that out there, and we did try 2 sessions, one in the morning and one at night. Unfortunately, the morning wasn't as successful. We gave it a good try. So going forward, we are just having the 1 session at night.
And it's from 7 to 8:30, the second Thursday of the month. So in addition to that, there is also a national hotline. It's the National Maternal Mental Health Hotline. So for any prenatal, postnatal parents that are having a challenging time. Once you have a baby, things change. So as far as your sleep schedule, your eating schedule, lots of different things. Your relationship. So it's pretty common once you have a child that your feelings change, and it's pretty typical to have a heightened sense over a period of weeks. If it's happening for a longer period of time, there's a depression called postpartum depression that you can talk to with your OBGYN or a therapist to get support. But this National Maternal Mental Health Hotline is a place that you can call if you're having stressful thoughts and feelings. And that number is 1-833-TLC-MAMA, which is 1-833-852-6262. So that's another support that goes along with parenting. So just one other piece before I send it over to Brittany here is our local community behavioral and mental health center is called VinFen. So it's actually out of Lowell, and they have an amazing amount of resources to support residents as long as mobile crisis. So if your child is in a very stressful situation and you feel like they might be in an unsafe situation, you can call and get a mobile crisis team to come out and evaluate your child right on the spot. They have community crisis stabilization, routine outpatient services, which is therapy or groups, and that is all to be accessed through their VinFen website, or you can directly call their number, which is 866-388-2242.
I just want to add to the VinFin that it's really exciting. It's only been a few weeks where they've been up and running next to Lowell General Hospital. So they have a new location at Varnum Ave, and they do have beds available for youth and adult. And then I just wanted to highlight some of the other things. I know Nicole had already said our local Community Behavioral Health Center is VinFin, but also in general for the state of Mass, we have the Massachusetts Behavioral Health Helpline, and that's something we've been really trying to push out to have residents call if they need help with mental health or substance use. Excuse me. But it's also not limited to that. If they're just looking on where to go, they can call that number and be referred. It's a warm handoff, no insurance is required, so that they have a starting place. That was the idea, is to have a place, because it could be really overwhelming when you're going through a challenge to, try to find the services that you need. Nicole and I always like to say as well, you can call Nicole, call myself, and email. We're supports as well as Allison, the town social worker, so we really like to get that out there for those who are unaware. And then we also have NAMI. NAMI has it's the National Alliance on Mental Illness, but they also have specific to Massachusetts, and they actually have a hotline that is Monday through Friday that you could call for services as well, and that's specifically on the Mass NAMI website. So there's quite a few resources. Sometimes it could be overwhelming. Like I said, you could always call Nicole or myself, and Nicole also has open office hours, correct?
So they've shifted a little bit. So we did try, it was a trial. Ben was very supportive as far as, I think most people are aware, he has open hours at the J.B. Fletcher Library, so I adopted his format to also have that. I think timing can sometimes be a challenge, so we're reevaluating with that piece. But, I know Brittany did mention, we do have a town social worker, so she's been here for quite some time. She is housed at the senior center, so I think sometimes people may feel or have the understanding that she's solely for seniors in Westford. But Allison is available to any resident. And there's 2 outreach workers as well at the senior center, but really the reason we're sharing that is so that residents do have an understanding that there are supports in town that can help you navigate the mental health system, the substance use disorder system. We have, resources around parenting. Allison can also help with financial supports, so navigating what's available for residents around those financial means within the state and federally as well.
I also want to talk about the ARBA financial aid assistance for the summer program and the after-school care. That is something that I was previously assisting, reviewing applications. If you're unaware of what that is, it's to get financial aid for either summer camp or after-school care, and that comes through ARBA funding, and that goes through the rec department. So if that's something you're interested in, I no longer am reviewing the applications, but Nicole is. So if you reach out to Nicole, she will give you the application. We're really happy and excited for people to apply for that, because when we talk about mental health, childcare could definitely be a huge burden. So you would see on the application the eligibility. It's 300% above the poverty line, so if you qualify, then you'd be able to access those services, and Nicole would be your contact person.
I think there was one other support around a 988,
Yep.
if you'd like. Did you share that piece already?
No.
Okay.
So the National Suicide and Crisis Lifeline is 988. That is more recent in the years. If you call the old number, it will still guide you to the same thing. And really it's for prevention on suicide. So calling that number if you're feeling distressed and you need the support, you can call that number. There is a differentiation between 988 and 911, and they would also have the ability to refer you to 911 if that is needed. And let's see if I'm missing anything else.
One other piece with 988. So if you're in a situation where you're with a loved one, a friend, and you are concerned about maybe they're having suicidal thoughts or they've expressed something to you and they're not willing to call, you can call on their behalf or call with them. It's a resource for anybody. So that's another support for somebody that's experiencing those challenges.
Yeah, and to note as well, I know several town vehicles are affixed with stickers that have the number on there, so it's certainly hard to forget. I want to backtrack a little bit because one of you had mentioned substance use, and that train of thought led me to opioid settlements. So a lot of these programs do cost money. A lot of them, I know the program that Brittany had mentioned, the after-school care, was funded through ARPA. I know there was some rental assistance that the Council on Aging had requested for seniors that was paid through ARPA. I'm not sure if all of that's been expended at the time of recording, which today is May 16th, 2024. But I want to talk a bit about the opioid settlement, the funding from that, what you guys have done with that, because it's been about a year since we've had an update on that. So I'd like to learn a bit more about that.
Yeah, so we are going to receive, the town of Westford will receive funds it's about 2038 that will be receiving funds, and we're still getting additional funds through different settlements. So some of the settlements are with local pharmacies, so for example like Walgreens or Walmart or things of that such. So really it's to support communities. The state received funding as well, so BSAS is getting funding for their different types of programs as well. So Westford really looked at data and what's occurring within our area. We've done conversations with residents. We had an open forum to get feedback from residents of how really should we utilize these funds, what are people's experiences, what are those with lived experience or have a loved one who've had these experiences, and then kind of evaluating and discussing with town departments, police, fire, the health department, the senior center, and other departments of how could we best utilize these funds. So some of the ways that the funds have been used recently, we're going to be getting new kiosks for, I'm going to get the language wrong, in the police department, and we'll be getting
disposal.
Thank you, for sharps and medication. Is that true? For the two disposals in the police station,
I believe that. Yeah, I believe that's true.
And then we're going to be putting one in the fire department as well, so there'll be a new location. There is a service at Westford Academy this year and Neshoba Technical Regional High School, which is called Cartwheel. So Cartwheel is a service for adolescents that can help providers, so for school guidance, to kind of get training and different platforms and supports around challenges with mental health, but then also the students can get direct care. So they can get a referral to a therapist through the Cartwheel services. And that really falls in line with the use of the funds, so that was a one-time use for the funds. We're also funding the adult mental health first aid and the youth mental health first aid trainings and their resources and curriculum. So that's some of the use that we've done. So that's just a little bit about how we've utilized the funds, but in addition to that, we're really trying to get feedback from residents on their experiences and ideas on how these funds could be used now and in future years. So we could, you could email us or you could call us, Brittany or I. Both of our information are on the town website, as far as our email and our, our phone numbers. And if that's not comfortable, as far as that type of communication, you're welcome to stop into our offices, and talk to us that way as well. Really just trying to elicit the feedback from residents. We will be doing some surveying with local doctors' offices and therapists and other providers in town, SANS and other agencies, to see maybe what their thoughts are as well.
I did want to add as well that we have the opioid overdose rescue kits, and those are called Sandbox. So if you've seen that, that's in all of our town buildings and school. And the Sandbox includes 2 4-milligram doses of Narcan and how to stop an overdose with Narcan. Some of the questions we get sometimes is, well, why would we have that in an elementary school or here or there? And the point is really talking about harm reduction and prevention. In the event that you need to use it, we want people to have access to that because we're talking about people, and sometimes that gets missing from the conversation, is that we're really talking about people's moms, dads, brothers, and there is no background, gender, age, anything to opioid overdoses or having a substance use disorder. So we want to make sure that we have that in our town schools and buildings. We're also working at the health department to have it in the businesses. I believe off the top of my head we have more than 10 businesses that have that as well. So if you've seen that, we're trying to push that out. We have it for free, so if your business is interested in receiving a Sandbox, reach out to me. My email is bnash@westfordma.gov. I will give you a Narcan training and we will go over that. So the idea is to not ever have to use it, but we have it if we need it, and just going to local businesses and talking to people. Everyone knows someone who has a substance use disorder or has unfortunately lost someone, and we're trying to change that. So that's one of the things that we're doing as well.
Yeah, absolutely. And I always like to just make a note, as you had mentioned, folks can email you. The emails will be in the description of the video, but if there are any sensitive topics, emails to westfordma.gov. Email are public record for the most part. There are exceptions, but be mindful of that when using email. I always like to make a note about that. But on the topic of the Sandboxes, I know they're free to businesses. We have one here at WestfordCAT, but I know you'd mentioned it shows you how to use it, but you don't throw people to the wolves. You guys do training for that as well.
Yeah,
correct.
so training could be as little as 5 minutes. It could be a more extensive training as an hour, because we do get a lot of questions about it. So it really depends on what someone is looking for. We also at the Westford Health Department have Narcan rescue kits that anyone can pick up Monday through Friday. I will go over a brief training on Narcan, how to use it, how to stop an overdose, how to look for signs of an overdose. So we will give you all the skills and information that is needed, whether that's 5 minutes or you have more questions. We're willing to figure that out. I'm willing to go to you, or you can come to us. So we're really open and want the information out there as much as possible.
Absolutely, absolutely. Seems like you guys have a lot of things offered over at the department. Along with that, you still, I believe, have COVID test kits as well available for folks. Correct?
I'm not sure.
You're not sure.
I'm sorry.
Perhaps. But I do think, when talking about mental health, it's important to touch on not only your mental health, but your physical health, your emotional health, your financial health, your social health, what have you. Are there any other events or items that you guys will be doing beyond this month? Because I do feel the conversation isn't just important in May. Just because there's a proclamation in May doesn't mean the conversation stops here. It continues on year round. It's 24/7, 365. So are there any items that are coming up perhaps this summer, later this year, that are you feel are pertinent for folks if they may be seeking a resource or looking for something to do?
I think one thing comes to mind is October is Domestic Violence Awareness Month. So you will see purple lights out on the gazebo. We have domestic violence awareness signs as well. And we also have a Westford Coalition for Nonviolence, and Gail, our public health nurse, is the co-chair to that. So if you're looking to get involved, volunteer, just offer your input. We're always looking for more people to be a part of our committee. We're a small group, and right now we're working on wallet cards on what a healthy relationship looks like and what it does not look like. But also we have information on Alternative House, which is one of our local DV shelters that we have as support. So we're always looking for people to get involved. you can reach out to Gail, the co-chair, myself, Nicole. We both sit on that committee as well. So we'll be doing work in October around that. And we usually, every month has something going on. There's always multiple things. So we are also open to feedback to anyone, anything of importance that we can highlight more or do more for the community. We're willing to hear it, because Nicole and I aren't just limited to substance use and mental health. We can do, other topics and other things which we're excited about. So just reach out to us so that we can, also provide awareness on other things besides that.
We will be having, we don't have the date yet, but it will be coming up soon. We will be doing an open forum for the substance use abatement funds, so the opioid settlement funds. We will be doing that in June, so we will be having that coming out soon. And we do post the information on the town website and in the town manager newsletter as far as when we're having events we will most likely be doing it virtually, potentially in person, but just giving people an opportunity maybe in that way to be able to share their thoughts as far as ideas for the use of the funds.
Absolutely, absolutely. Sounds like there's a lot of exciting things coming up for sure, and you guys should be very proud of the work that you're doing, and I'm sure it is very appreciated around town. But we're running pretty low on time. I just want to leave a few minutes. Are there any other last thoughts or anything that you guys want to touch on for folks that may otherwise be curious? Folks who may be curious about getting involved with your committees, folks who may need help. Is there anything else that you'd like to add?
So kind of reiterating a little bit about what we said, but I think that, I think you said it as far as, this is the May is Mental Health Awareness Month, but, our mental health is all the time, so that piece that it's, your overall well-being and how to support you. And if you're in need and not sure how to get supports, we are available. I'll add Allison Christopher, our town social worker, in there as well. If for some reason one of us isn't able to help you, we're amazing at connecting you with one another. As far as, if I can't assist you and Brittany can, or if I can't and Allison can, or vice versa. We're a network to one another as well. So we will get you the supports that you need, and hopefully be able to answer the questions that you have as well, so that you're not alone, that there are people that can help and support you. Our Community Behavioral and Mental Health Committee is meeting on Monday. We typically meet the fourth Monday of every month. However, with holidays and things, that can change, so just look on the town website. We do have a page there for upcoming dates of meetings, our minutes, and our agendas. It is an open meeting, so anybody is available to attend virtually or in person.
Absolutely. Do you have anything else on your end that you'd like to add?
I think Nicole summed it up pretty well. Okay. We want to highlight just May in general. We say May is Mental Health Awareness Month, and sometimes we're really focused on, the diagnosis and the challenges, but I always want to include that there is hope. So please, if you need something, reach out. You're never alone in any of this, so we just want to be there for as many people as possible, whatever service we can offer, whatever we can help refer you to. Just know that we're here, and there's a lot of hope, and sometimes that's missing from the conversation. So thank you.
Absolutely. Well, Nicole, Brittany, thank you very much.
Thank you.
Thank you.